بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, today our lecture is regarding the antihypertensive drugs that used for treatment of hypertension. First, hypertension is the most common cardiovascular disease. It affecting approximately about 30% of the adults. تقريبا 30% من الادults هم diagnosed as hypertensive patients. According to the American Heart Association, this American Heart Association defines hypertension as arterial blood pressure that higher than 140 over 90 millimeter mercury, whereas the WHO uses the value of 160 over 95 millimeter mercury. This is يمكن ناس ال WHO شوية هم بيقولوا الهايبرتنشن هو المفروض يكون أعلى من 160 على 59، لكن الأمريكان هارت أسوسيشن حتى من 140 على 90 بتقول إنه هو ده هايبرتنشن. Hypertension, unless rapid in onset and severe, does not produce noticeable symptoms. إذا ما لم هو كان rapid and severe، rapid في الأونست بتاعه ولا severe high blood pressure و free of symptoms، ما بكون يعني المريض ما بكون بيشعر بأي أعراض زي ما أنتم عارفين. According to the American Heart Association, we have different blood pressure categories. That the normal, in which you will find the systolic blood pressure is less than 120 and the diastolic is less than 80, elevated between 120 129 and the diastolic less than 80. High blood pressure, according to this American Heart Association, high blood pressure اللي هو stage 1 hypertension from 130 to 139, this is systolic, while the diastolic is less than 89. Higher blood pressure stage 2, according to the American Heart Association, is about 140 or higher, while the diastolic is about 90 or higher. And according to these categories, American Heart Association, severe hypertensive crisis, we'll find that the systolic blood pressure is higher than 180 and the diastolic is higher than 120. Hypertension, sustained arterial hypertension damages blood vessels in the kidney and in the brain and the heart, so that the hypertension should be managed or should be treated and should be reduced to the normal values, because if it sustain يعني إذا استمر hypertension ده لفترة طويلة without treatment, without علاج, this can lead to the damage of blood vessels of the kidney and the heart and the brain. Hypertension is an important risk factor, so for development of chronic kidney disease can lead to end kidney stage, renal failure, and heart failure. The incidence of morbidity and mortality both significantly decrease when hypertension is diagnosed early and probably treated. إذا شخصناه من بدري وأخذ العلاج المناسب فده significantly بيقلل الموربيديتي and المورتاليتي of the among the patients among the hypertensive patients. The major factors that influencing the blood pressure are cardiac output and the total peripheral resistance. Regarding the peripheral resistance, which affected by arterial tone, while the cardiac output mainly affected by the filling pressure and the contractility of the heart and the heart rate. The filling pressure is influenced by the venous tone and the blood volume, so that all of the antihypertensive drugs affect either the cardiac output or the peripheral vascular resistance, such as we have a vasodilator decrease the arterial tone, so it decreases the peripheral vascular resistance, so this will lead to decrease in blood pressure. While we have also the venodilator can decrease the venous resistance, and so also can stimulate or can increase the venous capacitance, so this will lead to increase the filling pressure. انه الفينوس هي بتمثل لها الريتين اللي هو البريلود للهارت الفينوس ريتين. Also, blood volume can be affected by diuretics. As we see in the last lecture, diuretics can decrease the blood volume, so this will decrease the feeling pressure, so can decrease the cardiac output. We have regarding the contractility of the heart, this can be affected by a beta blocker. As you know, selective beta 1 antagonist can decrease the force of contraction of the heart, because we know that the sympathogenic agent by acting on beta 1 receptor have positive inotropic, increase the contractility of the heart, and chronotropic, increase the rate of the heart rate, so that the beta blocker, especially selective beta 1 antagonist such as atenolol, can inhibit or can decrease the contractility and the heart rate, so this can lead to decrease in the cardiac output, so the overall effect will decrease the arterial blood pressure. As you know, the blood pressure is regulated by the autonomic nervous system exactly through the sympathetic nervous system and through the renin-angiotensin-aldosterone system, in which if there is a decrease in blood pressure for any reason, any decrease in blood pressure, this directly will stimulate the sympathetic activity, so there will be an increase in sympathetic activity. Increase in sympathetic activity, this will lead to the release of adrenaline, epinephrine on the blood, and this will act on both alpha and beta receptor, such as beta 1 and the activation of beta 1 receptor in the heart. This will increase the force of contraction and increase the heart rate. This will lead directly to an increase in the cardiac output. Also, the activation of alpha 1 receptor, which as we know that predominate on the blood vessels, this will lead to the vasoconstriction on the arterioles, on the arteries and arterioles, and this will directly increase the total peripheral resistance. Also, on the veins will increase venous retains, the preload of the heart, and this will increase the cardiac output and tend to increase the blood pressure. Also, the activation of beta 1 receptor, which occur on the kidney, just on the juxtaposed glomerulus apparatus, will lead to the release of renin, and you know that renin will stimulate the conversion of angiotensinogen to angiotensin 1, and then angiotensin 1 will be converted to angiotensin 2 through the angiotensin converting enzyme inhibitor enzymes, and this will lead to the production of angiotensin 2, which is a potent vasoconstrictor, about 40 times vasoconstrictor more than adrenaline, and this will lead to the increase in the peripheral resistance directly, and so increase the blood pressure. Also, as you know that the angiotensin 2 will lead to stimulate the release of aldosterone, and the aldosterone act on the kidneys to stimulate the sodium and water retention, and this will increase the blood volume and will increase the cardiac output. Also, the decrease in the blood pressure directly will influence the renal blood flow, lead to decrease in the renal blood flow, which lead to decrease in the glomerular filtration rate, and this directly will stimulate the water and sodium retention, and will lead to the increase in blood volume, and so will increase in the blood pressure. Now we'll talk about the classification of the antihypertensive agents. First, we have diuretics. We know now the diuretics. المحاضرة الأخيرة كانت كلها all about diuretics. As we know that diuretics lower the blood pressure by depleting the body of the sodium and reducing the blood volume. The second class of the antihypertensive agents, we have the sympatholytic drugs, which lower the blood pressure by reducing the peripheral, either by reducing the peripheral vascular resistance or by the inhibiting cardiac function, or by increasing the venous capacitance. And they include central acting sympatholytic drugs such as methyl dopa and clonidine. Methyl dopa and clonidine, we mentioned them before when we talk about the drugs that affect the biosynthesis of catecholamines. We have also ganglion blocking agents such as trimetaphan, and the adrenergic neuron blocking agents such as the guanethidine, which inhibit the release of norepinephrine from the neurons. Also, we have an adrenoreceptor antagonists such as the alpha and beta. Also, we have the direct vasodilators, which act directly on the smooth muscle by producing relaxation on this smooth muscle. This includes hydralazine and minoxidil, which are not used as primary drugs for treatment of hypertension. Nowadays, hydralazine especially is used for hypertension, for treatment of eclampsia, hypertension during pregnancy that result in eclampsia, and minoxidil now shifted for another use not related to the hypertension. These vasodilators act by producing relaxation on the vascular smooth muscle, primarily in the arteries and arterioles. This results in decreased peripheral vascular resistance and hence or therefore decrease the blood pressure. Also, we have the calcium channel blockers, which inhibit the calcium influx. We know that the calcium directly proportional, the percentage of or the calcium entrance directly proportional to the contraction or the force of contraction, so that they inhibit calcium channel blocker inhibit the calcium influx in the arterial smooth muscle, and this will lead to the arterial dilatation. Also, we have the agent that block the production or action of angiotensin. We have two types of drugs that can affect the angiotensin effect, because we know that the angiotensin 2 is a powerful, potent vasoconstrictor, so that by inhibition the production or by antagonizing angiotensin 2 receptor we can produce or we can decrease the blood pressure. First, they reduce peripheral vascular resistance and potentially blood volume, and these drugs that affect the angiotensin include angiotensin converting enzyme inhibitors. We abbreviate نختصرها ب ACE inhibitors, angiotensin converting enzyme inhibitors such as enalapril, lisinopril, captopril, and angiotensin receptor blocking drugs that just block the angiotensin 2 receptors such as losartan and valsartan and candesartan. ديل بيعملوا بلوكج للانجيوتنسين ريسبتور، فبالتالي can interfere with the vasoconstrictor or vasoconstriction that can be produced by angiotensin 2 by acting on angiotensin receptors. First, we will talk in detail about these antihypertensive drugs. We know we have a separate lecture regarding the diuretics. فقط الآن بنتكلم عنها كلام عام عن الاستخدام بتاعها في treatment of hypertension. Diuretics lower blood pressure primarily, as we mentioned, by depleting body sodium stores. Diuretics are effective in lowering blood pressure by 10 to 15 millimeter mercury in most patients, and diuretics alone often provide adequate treatment for mild or moderate essential hypertension. In case of more severe hypertension, diuretics are used in combination, not alone, in combination either with sympatholytic. لما نقول sympatholytic معناها قاصدين alpha blocker أو beta blocker، الاثنين هم sympatholytic، أو حتى قاصدين الميثايل دوبا والكولونيدين، كلهم هم يعتبروا sympatholytic drugs or اللي هو vasodilator drugs. Regarding the selection of diuretics in treatment of hypertension, we have that thiazide diuretics are appropriate for most patients with mild to moderate hypertension and normal renal and cardiac function. إذا كان المريض هو عنده normal renal and cardiac function وهو suffer from mild to moderate hypertension, thiazide is a good choice. If there is in case of severe hypertension, here the choice is preferred to لللوب diuretics. More powerful diuretics, those acting on the loop of Henle, are necessarily in case of severe hypertension, as we mentioned before. While the potassium sparing diuretics are useful both to avoid excessive potassium loss، ان البيشنت متوقعين عنده هو يكون عنده potassium loss due to the use of other diuretics, thiazide and loop diuretics, and particularly in patients taking digitalis such as digoxin, drugs that used for treatment of heart failure. عندهم lower therapeutic index، عندهم بروفايل، عندهم lower therapeutic index. in case of التوكسيسيتي بتاعتهم هتزيد ان كيس اذا كان المريض خش في هايبوكاليميا. الهايبوكاليميا will stimulate will increase the digitalis toxicity, so that to avoid the digitalis toxicity. واصلا احنا عارفين الديجيتاليز عندها lower therapeutic index، فبيحصل لها enhancement in case of hypokalemia. Also البوتاسيوم sparing diuretics هي بتعمل enhancement للناتوريتيك effects of other diuretics اللي هم اللوب and thiazide diuretic. الميثايل دوبا اللي هو الالدوميت، مشهور بالالدوميت trade name. as we see before, it's converted to methyl norepinephrine centrally في الادرينرgic neuron on the central nervous system to diminish adrenergic outflow from the CNS. فبالتالي هو لما يحصل له ريليز هو بيكون عباره عن ميثايل نورابينفرين، وهو قلنا فاست نيورو ترانسميتر، هو فاست نيورو ترانسميتر that does not activate the adrenergic receptor اللي هم الالفا والبيتا ريسبتور. although انه هو عنده الان لقينا انه عنده it is as an alpha 2 agonist، وكونه يكون alpha 2 agonist ده معناها بيشتغل بري ساينابتيكالي في الالفا 2 ريسبتور اللي اتكلمنا عنها قبل كده، ومعناها هو هيعمل شنو؟ معناها هيعمل نيجاتيف فيدباك ميكانيزم، معناها هيقلل السمباثيك اوت فلو، هيقلل السمباثيك اوت فلو such as الكولونيدين زي الكولونيدين. The most common side effects of methyl dopa are sedation and drowsiness, CNS adverse effects, and so that methyl dopa should be avoided in elderly patient نتيجة للسيديشن اللي بيعملوه، لأنه ممكن كان increase the risk to fall down which is more commonly to be like or to happen in the elderly patients. The use of methyl dopa is limited due to the adverse effects and the need of multiple daily doses. It is mainly used for management of hypertension in pregnancy because it has a record of safety. لأنه لقيناه هو safe في البريجنسي، الآن نحن بنستخدمه for treatment of pregnancy hypertension. The clonidine, the mechanism of action of clonidine, as we mentioned, the hypertensive effect of clonidine is exerted at alpha 2 adrenoceptor in the medulla, centrally acting on the brain. Clonidine and the alpha methyl norepinephrine اللي هو الميثايل دوبا bind more tightly to the alpha 2 receptor than alpha 1 adrenoceptor. and we mentioned alpha 2 receptor موجودة pre-synaptically، والاكتيفيشن بتاعها بيعمل انهبيشن للادينيليز سايكليز، بالتالي هيقلل السايكل كي ام بي، ولما يقلل السايكل كي ام بي معناه هيقلل لي الانترانس بتاع الكالسيوم، قلل لي الانترانس بتاع الكالسيوم معناه قلل لي الريليز بتاع النيورو ترانسميتر بواسطة الاكزوسايتوزيس. It acts in the brain to reduce norepinephrine release, negative feedback mechanism as we mentioned, out to relevant receptor sites. بالتالي cannot activate the relevant receptors اللي هي الموجودة post synaptically, alpha and beta receptors that occur post synaptically. The side effects of clonidine include dry mouth and sedation, are frequent and may be severe. These side effects are common واحيانا يكون هم severe side effects, dry mouth and sedation. The drug should not be given to patients who are at a risk of mental depression and should be withdrawn if depression occurs during therapy. لأنه هو كان exacerbate، هو ممكن يعمل depression الكلونيدين، وبالتالي المريض اللي عنده depression ممكن كان exacerbate this depression اللي هو الاكتئاب في المرضى اللي بيعانوا أصلا من الاكتئاب. Withdrawal of clonidine after protracted use, particularly with higher dosages such that greater than 1 mg per day, can result in life-threatening hypertensive crisis that mediated by increased sympathetic nervous system activity. ليه؟ لأنه الكلونيدين هو بيعمل لي نيجاتيف فيدباك ميكانيزم، هو حاجز لي، يعني كأننا عندنا جدول بتاع مويه نحن سادينه عاملين له ترس عاملين له حاجز، ده هو الكلونيدين. فلو وقفناه وسحبناه فجأة، بالذات لو سحبناه خاصة كان بجرعة كبيرة وسحبناه بصورة مفاجئة، ده طوالي معناها هيعمل لي اوت فلو انكريز، تكسير للجدول ده وايد سبريد او وايد انكريز في السمباثيتك اكتيفيتي، ودي ممكن تعمل لي هايبرتنسيف كرايسيس. سو ذات البيشنت اللي بياخدوا كلونيدين دايرين نسحبه دايرين نوقفه، we should use tapering or gradual withdrawal، نقلل الجرعة تدريجيا لحد ما نسحبه بطريقة تناقصية تدريجية to avoid this hypertensive crisis that can result from abrupt withdrawal of clonidine. Patients exhibit nervousness, tachycardia, headache, and sweating after omitting 1 or 2 doses of the drug. This is withdrawal symptoms that observed in the patient taking clonidine. If the dose is lost or absent, the patient may exhibit these side effects: nervousness, tachycardia, headache, and sweating نتيجة للفقدان بتاع الجرعة بتاعت الكلونيدين. We have a ganglion blocking agent, and we mentioned also this before. The ganglion blockers competitively block nicotinic cholineceptor on both synaptic neurons in both sympathetic and parasympathetic ganglia. لأنه احنا we mentioned that the ganglion is the same for both sympathetic and parasympathetic nervous system. We have a trimethophan, which is very short-acting drug. It occasionally used as an intravenous infusion to produce control hypotension and minimize bleeding during certain types of surgery. To control blood pressure، عشان ما نحافظ على البلد بريشر ما يكون مرتفع ندي ترايميثافان، لانه معروف انه هو بيقلل البلد بريشر. وزي ما ذكرت لكم before as I mentioned before that the ganglion blocking agents due to the blockage of both sympathetic and parasympathetic so that the effect cannot be expected. فقط نحن لابد نشوفها كلينيكالي او نشوفها في البراكتس او اكسبيرمنتالي هو بيعمل شنو، بعد ذاك نعرفه. لكن لانه we know that both sympathetic and parasympathetic are tend to antagonize each other so that the effects produced are not predictable. Trimethophan can also be used to lower blood pressure as an emergency procedure. وانا ذكرت لكم الكلام ده، قلت لكم الترايميثوفان هو الوحيد من الجانجليون blocking drugs اللي بنستخدم clinically to decrease the blood pressure in case of emergency and in some of the operation or surgery situation to control the blood pressure. Trimethophan adverse effects include sympathoplegia معناها failure of the sympathetic activity. This can result in excessive orthostatic hypotension and sexual dysfunction. Also can produce parasympathoplegia واللي هي failure or antagonist effects that of result from a cholinergic antagonist. And this is observed as constipation, urinary retention, precipitation of glaucoma due to the increase in intraocular pressure, blurred vision, dry mouth, and so on. We have a reserpine, and the reserpine, the mechanism of action of reserpine, also we know it because reserpine, one of the drugs that can affect the biosynthesis and storage of the catecholamines because it can lead to the depletion, because it blocks the carrier molecules that lead to the packaging or accumulation of the catecholamines in the vesicles. Reserpine blocks the ability of aminergic transmitter vesicles to take up and store biogenic amines. This effect occurs throughout the body, both centrally and peripherally, resulting in depletion of norepinephrine, dopamine, and serotonin in both central and peripheral neurons. Reserpine يمكن هو the first drug in history that used for treatment of hypertension. هو obtained from a plant, Raulfia plant, alkaloid that obtained from a plant. So يمكن هو the first drug in history that used for treatment of hypertension. Nowadays it only used for experimentally, but was at one time used as an antihypertensive drug, as I mentioned. Its central effects, especially depression, can يعمل depression زي الكلونيدين, which probably result from impairment of noradrenergic and 5-hydroxytryptamine mediated transmission in the brain are serious disadvantage. واحدة من الادفانتجز الكبيرة جدا له والديسادفانتجز الكبيرة للريزربين ان هو يعمل لي central يعمل لي depression اكتئاب. Regarding adrenoceptor antagonist, both we have both beta blockers and alpha blockers. As we mentioned before, they can be used for treatment of hypertension. First, we have propranolol beta blocker. It's very useful for lowering blood pressure in mild to moderate hypertension. Propranolol in case of severe hypertension is very useful in preventing the reflex tachycardia that often result from treatment of direct or treatment with direct vasodilator, because direct vasodilator can cause reflex tachycardia due to the stimulation of reflex that arise from the baroreceptor. So this will lead to sympathetic stimulation, centrally sympathetic stimulation. This can result in reflex tachycardia due to the direct vasodilator. This reflex tachycardia can be prevented by propranolol, because when there is noradrenaline released due to this reflex, we'll find that the beta receptors are closed by or blocked by propranolol. As we know that beta blockers, beta adrenoceptor blockers will prevent the activation of both beta receptor, especially here we have regarding the cardiovascular, we concern mainly with beta 1 which occur on the heart and beta 1 that occur on the kidney. The activation of beta 1 on the heart, as you know, will increase the heart rate and the force of contraction, so this can be inhibited and this can lead to the decrease in the cardiac output, and therefore this will lead to decrease in the blood pressure. Also, the inhibition of the activation of beta 1 that occur in the renal, in the kidney, in the glomerular apparatus, which secrete the renin, and the renin then will stimulate angiotensin 2, the production of angiotensin 2 through activation of angiotensinogen. So by inhibiting this beta 1 adrenoceptor on the kidney, we will decrease renin, so we will lead to decrease in the formation of angiotensin 2, which as we know, the potent vasoconstrictor, so this will lead to decrease in peripheral vascular resistance. Also, you know that and the angiotensin stimulate aldosterone secretion from the adrenal cortex, and the aldosterone will increase the sodium and water retention. By inhibiting this, we will decrease the sodium and water retention, and then we will decrease the blood volume, so we will decrease the cardiac output, and therefore we will finally decrease the blood pressure. We have atenolol, betoxolol, and bisoprolol. All of these beta blockers are selective beta 1 blockers. Atenolol, which is selective beta 1 blocker, is not appreciably metabolized and excreted to a considerable extent in the urine. Atenolol is less polar, so it is easily can be removed through the glomerular filtration on the kidney. Atenolol produces fewer central effects. This is also because it is less lipid soluble compared with propranolol, which is more lipid soluble. So that atenolol produces fewer central nervous system related effects than other more lipid-soluble beta antagonists such as propranolol. Betoxolol and bisoprolol are also, as I mentioned, selective beta-1 blocker that primarily metabolize in the liver and but have longer half-lives compared with atenolol. We have labetalol and carvedilol. These unique beta blockers because they also block alpha-1 receptor. So they block alpha-1, beta-1, and beta-2 receptors. Labetalol is useful in treating the hypertension of pheochromocytoma due to the blockage of both alpha and beta receptor, management of gestational hypertension because they are safe in pregnancy. So labetalol can be used for treatment of pregnancy hypertension during pregnancy, and also these two drugs, labetalol and carvedilol, can be used for treatment of hypertensive emergencies. Carvedilol, although an effective antihypertensive, is mainly used in treatment of heart failure. Beta blocker also have a role in treatment of heart failure because they can decrease the heart work. So this can be sometimes beneficial in the case of heart failure. Now we have alpha blockers. And alpha blocker, we have selective alpha-1 blockers, prazosin, terazosin, doxazosin, produce most of their antihypertensive effect by selectively blocking alpha-1 receptor in arterioles and venules. Alpha blockers reduce arterial pressure by dilating both resistant and capacitance vessels, so this will decrease the total peripheral resistance, so leading to decrease in the blood pressure. These agents produce less reflex tachycardia when lowering blood pressure than do non-selective alpha antagonists such as albentolamine, because albentolamine and phenoxybenzamine are non-selective, so they are more susceptible to produce reflex tachycardia more than the selective alpha-1 blockers. The drugs are more effective when used in combination with other agents such as beta blocker and diuretic than when used alone. Alpha blocker في treatment of hypertension هي more effective لما نستخدمها in combination with other antihypertensive agents. Now we have vasodilators also have a role in treatment of hypertension, and the oral vasodilators اللي هو الهيدرالازين and minoxidil, which are used for long-term outpatient therapy of hypertension. Nowadays, hydralazine used all just in only in case of emergency, especially for treatment of eclampsia that associated with pregnancy or hypertensive pregnant women. Minoxidil now favored for just for treatment of other indication other than cardiovascular indications. Now it's used as stimulate the hair growth. This is okay at side effect, but now we use mainly for hair to induce the hair growth, minoxidil. Which are used, as we mentioned, orally for treatment of hypertension, while parenteral vasodilators such as nitroprusside and diazoxide and alvinol dobam are used for treatment of hypertensive emergency. This is used by parenteral IV mainly. The mechanism of action of vasodilator: all vasodilators are useful in hypertension because they relax the smooth muscle of the arteriole, so they decrease the total peripheral resistance, thereby decreasing systemic vascular resistance. Sodium nitroprusside also relax venules. Besides the arterioles, it also relax the veins. We have also the calcium channel blockers, an important group of drugs that have many cardiovascular clinical uses such as hypertension, angina. Example for the calcium channel, we have verapamil, lithiazine, and a dihydropyridine family. Dihydropyridine family include the amlodipine, الفيلودipine, النيفيدipine, and النيزولدipine. The verapamil, the first one, is mainly cardioselective. That is mean it mainly block the calcium channels that occur on the heart, while diltiazem have an intermediate action between the calcium channel on the heart and the calcium channels that occur on the blood vessels, while the dihydropyridine family or drugs mainly vasoselective, means that they mainly block the calcium channels that occur on the blood vessels. In addition to their anti-anginal and antiarrhythmic, the calcium channel blockers also reduce peripheral resistance and blood pressure. Mainly the calcium channel, as we know, because they block the calcium, so they interfere with the contraction upon the blood vessels, so this will lead to the vasodilatation, and this will increase the peripheral, or will decrease the peripheral resistance, and so will decrease the blood pressure. The mechanism of action in hypertension and in part in angina also, because we have some type of type of angina, Prinzmetal angina or oral vasospastic angina. The calcium channels can lead to vasodilatation in the coronary arteries. There is the inhibition of calcium influx into the arterial smooth muscle, so this leads to vasodilatation. Nifedipine and other dihydropyridine agents are more selective as vasodilator, as I mentioned, and have less cardiac depressant effect than verapamil and diltiazem. Verapamil had the greatest depressant effect on the heart and may decrease the heart rate and the cardiac output. Diltiazem has intermediate action between these two drugs. So this is the effects that produced by these calcium channel blockers. First, dilatation of the coronary arteries. We'll find nifedipine vasoselective, and also diltiazem can produce dilatation on the coronary vessels, blood vessels, while on the heart, AV conduction through the ventricle, we have that the nifedipine is more, the verapamil is more effective, so it's cardiac selective, while diltiazem have an intermediate action. While nifedipine may have little effect or even can increase the AV conduction, while the HLAs, the frequency and the incidence of the adverse effects, we will find that nifedipine اللي هو كمثال هو تايب واحد من الدايهيدروبيريدين كالسيوم channel blockers have more frequent or increased frequency of adverse effects, about 18%, verapamil less 9%, and diltiazem is less infrequent in producing adverse effects. We have angiotensin converting enzyme inhibitors such as lisinopril, captopril, enalapril, ramipril. The mechanism of action of these AAC inhibitors, they inhibit the converting enzyme اللي هو ده عبارة عن بيبتيدايل دايبيبتيديز that hydrolyzes angiotensin 1 to angiotensin 2. بيحولها angiotensin 1 to the angiotensin 2, which is more potent, and also inactivate bradykinin. This enzyme, angiotensin converting enzyme, also inactivate bradykinin. Bradykinin is an potent vasodilator. So as you know that angiotensinogen, which is synthesized from the liver, is activated by the renin that released from the kidney to angiotensin 1, which is an inactive, which is activated by angiotensin converting enzyme, to angiotensin 2, which is very potent. When act on its receptor, it will stimulate or produce increase peripheral resistance through the vasoconstriction. Also, it stimulates aldosterone secretion, so it can stimulate sodium and water retention. So angiotensin tend to arise the blood pressure. While by inhibiting, we have drugs that are renin inhibitors, we can inhibit the effect of angiotensin. Also, we have AC inhibitors the mentioned drugs on the slide also can decrease the effects of angiotensin. Also, we have angiotensin receptor blockers such as losartan or valsartan or candesartan can inhibit the effects of angiotensin on its receptor. The overall effect can lead to decrease lead to decreased blood pressure of all of these group of drugs. Also, we hear this is a site of angiotensin or aldosterone receptor antagonist. We should talk about it previously, such as spironolactone. Also, it can decrease the blood pressure by interfering with the action of aldosterone on its receptor on the kidney. The clinical use of angiotensin converting enzyme inhibitors include hypertension. Or the AC inhibitor have a particular useful role in the treating patient with chronic kidney disease because they diminish proteinuria and stabilize renal function. They reduce intraglomerular pressure by inhibiting the angiotensin 2 mediated efferent arteriole vasoconstriction، لانه الانجيوتنسين 2 بيعمل potent vasoconstrictor، بالتالي بيعمل constriction في الافرنت ارتريول وده بيؤدي لي البريزنس بتاع البروتينز في اليورين. فلما نعمل ريلاكسيشن we will diminish، هنعالج نقلل من البروتين يوريا and this will stabilize the renal function. Angiotensin converting enzyme inhibitor also have renoprotective properties which may be particularly due to the other hemodynamic and non-hemodynamic effects of these drugs. فعشان كده دائما هي مفضلة للبيشن اللي عندهم هايبرتنشن وفي نفس الوقت عندهم renal impairment. فالدواء هنا مفضلة الangiotensin converting enzyme are prepared due to the renoprotective properties of these drugs. ACE inhibitors have also proved to be extremely useful in treatment of heart failure and after myocardial infarction. The adverse effects or side effects of the angiotensin converting enzyme inhibitors include first dry cough, and the dry cough mainly due to the accumulation of bradykinin on the lung, because bradykinin is metabolized by this enzyme, angiotensin converting enzyme. So the inhibition of this enzyme will lead to the accumulation of bradykinin, and this mainly will result in dry cough. Also, they famous by producing hyperkalemia, increase blood potassium. The shared side effects of these drugs is the skin rash and swelling of the tissue, edema, angioedema. Also, severe hypotension may result from this drug, angiotensin converting enzyme inhibitors. Bradykinin and substance B seem to be responsible for the cough and angioedema seen with angiotensin converting enzyme inhibition, as we mentioned. The use of angiotensin converting enzyme inhibitor is contraindicated during the second and third trimesters of pregnancy because of the risk of fetal hypotension, anuria, and renal failure in the neonate or on the fetus, sometimes associated with fetal malformation or death. So that the overall effect is that angiotensin converting enzyme inhibitors are contraindicated during pregnancy. There is recent evidence also implicates the first trimester exposure to AC angiotensin converting enzyme inhibitors is increased teratogenic risk, so that AC inhibitors are contraindicated on all of the 3 trimesters of pregnancy, first, second, and third. Last, we have angiotensin receptor blocking agents. These include losartan, valsartan, candesartan, and irbesartan, suffix with sartan. The mechanism of action, they block the angiotensin 2 receptor. They have no effect on bradykinin metabolism. يمكن ده السبب the first reason over developing this type of drugs is that to avoid the accumulation of bradykinin, which is, as we mentioned before, responsible for the dry cough that produced by the angiotensin converting enzyme inhibitor drugs. Angiotensin receptor blockers provide benefits like those of AC inhibitor in patients with heart failure and chronic renal disease. هم برضه ممكن نستخدمهم معناها للبيشنت اللي عندهم heart failure and chronic kidney disease زيهم وزي الangiotensin converting enzyme. And the adverse effects of angiotensin receptor blocking agents are like those described for AC inhibitor, including the hazard of fuse during pregnancy. Also, that means they are also contraindicated during pregnancy. But the cough and angioedema, which can occur also with this type of drugs, but are less common with angiotensin receptor blockers compared with the AC inhibitors, because they does not, as we mentioned, does not affect the degradation of bradykinin. Last, this is a treatment of hypertension in patients with concomitant diseases. First, if a patient has a high coronary disease risk, such as angina, we can use, for treatment of hypertension, we can either use diuretics with beta blockers or AC angiotensin converting enzyme inhibitor, or even the calcium channel blocker also can be used, because also calcium channel blockers are beneficial in treatment of angina. If the patient, beside hypertension, there is a diabetic patient, has diabetes, here we can use diuretics. We should avoid beta blocker, because we know that beta blockers can mask the symptoms of hypoglycemia, so that they should be used cautiously in patients with diabetes. AC angiotensin converting enzyme inhibitor can be used, and angiotensin receptor blocker also can be used. This is beside also calcium channel blocker can be used in patients with hypertension and diabetes. If the patient have recurrent stroke, we can diuretics is a suitable choice. This is beside angiotensin converting enzyme inhibitors. If the patient suffer from heart failure with hypertension, we can use all of these drugs: diuretics, beta blockers, angiotensin converting enzyme inhibitors, angiotensin receptor blockers, and aldosterone receptor antagonists. If there is in a patient previous myocardial infarction with hypertension, we can use beta blocker, angiotensin converting enzyme inhibitors, and aldosterone receptor antagonist. If the patient with hypertension have a chronic renal disease, as we mentioned before, angiotensin converting enzyme inhibitors and angiotensin receptor blockers are a good choice, because due to their renoprotective properties. I think that is all regarding hypertension. We have some study questions. A 45-year-old man was just started on a therapy for hypertension and developed a persistent dry cough, which is most likely responsible for these side effects. Definitely, it will be enalapril, the first choice, angiotensin converting enzyme inhibitor. If there is no in this answer there is no enalapril, the second choice will be losartan. But because enalapril is one of these choices, it will be the best choice. Which may cause reflex tachycardia and or postural hypotension on initial administration? Is it atenolol or hydrochlorothiazide, metoprolol, prazosin, or verapamil? The right answer is prazosin, the alpha blocker. The alpha blocker can cause reflex tachycardia and postural hypotension, as we mentioned when we talked about the alpha blocker on the adrenergic antagonist, which can precipitate a hypertensive crisis following abrupt cessation of therapy. The choice is clonidine. Clonidine can precipitate hypertensive crisis because clonidine is a selective alpha-2 agonist, so it inhibits it causes negative feedback mechanisms. So when we stopped clonidine, this negative feedback mechanism will be diminished, and there will be an increase in sympathetic outflow. This will result in hypertensive crisis. Last, a patient returns to her healthcare provider for routine monitoring 3 months after her hypertension regimen was modified. Labs revealed elevated serum potassium. المراجعة on an investigation, there is an elevated serum potassium hyperkalemia, which is likely responsible for this hyperkalemia. Chlorthalidone, thiazide-like diuretic, clonidine, furosemide, losartan, nifedipine. It will be the losartan, losartan, because it is an angiotensin receptor blocker which have adverse effect profile that resemble the adverse effects of angiotensin converting enzyme inhibitor. That is all. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.